This is the perfect session for all of you kids out there that have sore hands, wrists, fingers, arthritis, repetitive motion issues, anything that has to do with hands, wrists, and even your shoulders. All right, so I'm going to teach you a sure way to get this under control. It might not take away all of the pain, but it's going to help keep your mobility and make your hands always functional. All right, so this is what we're going to do. For best results, do this entire thing once a day, all of it. You can be watching TV, hanging out. It's not hard to do, and it will benefit you in the long run. Now, throughout the entire day, we want to do this one little move often, and it's fast. So you need a table, and our goal is to take our hands and open our fingers up. So really focus on pulling the thumb back. So we want to open our hands as much as possible. Remember to stay in that postural position. Place your hands on the table, and we want to lean over the table until our hands are flat on the table surface, and our wrist, elbow, and shoulders are in alignment. That's your goal. We want to hold this position for 1, 2, 3. That's it. Now, if you cannot get your hands flat on the table surface, do not force the issue. This is going to take a while. We do not want the muscles to get stiff and sore again. We want mobility. So, if your fingers are starting to curl in like this, do not do any movement that squeezes a ball. We need to do the opposite, and this is where we start. All right, now remember, all through the day, our goal is this for a 3 count. 1, 2, and 3. Okay, now the next step is we want to start massaging the meaty part of the thumb. Now, it's probably going to be bruised, so just do it gently. We want to be kind to these muscles. We don't want to abuse it. Then we're going to come up right here. So you're going to feel this fleshy part in the arm, and we want to do little circles from the elbow down, and you'll feel where the muscle starts to go underneath the bone again. That's where we're going to stop. And as you notice, I'm not spending a lot of time on it because we do not want to add more trauma to the muscle. Now let's go to the other hand. Remember, we're not pulling the thumb in, we're pulling it back. And we're just doing like a pressure point, like a pulse. And come back to this fleshy part, the forearm. Now we're going to go into a finger stretch. It's important that we start allowing the arm to come straight out, and we never want to cross over the body. So we're going to push the hand out, gently pull back on the thumb, index finger, middle finger, ring finger, pinky, gently pull down so we get a gentle stretch at the top of the hand. And then if we're tight through here, you'll get a stretch. If not, you won't get a stretch. Other hand. Don't pull over. You want to keep the arm in alignment with the shoulder. Middle finger, ring finger, baby finger. Down, pull up. Okay, now you're going to need a ball for this one, a tennis ball. Hold it in your hand, have your hand to the side, and you want your palm facing your body, so you're straight up and down. These movements you'll have to do standing up. Okay, now we're going to do circles. We want to keep the elbow in the locked position because we do not want anything moving but the wrist. You should have a gentle grasp on the ball. Change directions. Now we're going to go back and forth. So back and forth with the wrist. And forward and backward. Extend the arm out to the side. And we're going to rotate up to the ceiling and around. So you want to do full rotation, down to the side. Keep that postural position out front. Remember, we are not crossing over the body. straight up to the ceiling. Other hand. We're going to start back and forth, side to side, circles. Nothing moves but that wrist. Your hand is the only thing that's moving. Other direction. Extend arm out to the side. Rotate. We want to try to get full range of motion without contorting our body to make it happen. So it should be natural. Down by your side. Out in front. And we're only doing 3 rotations, nothing big. Remember, this is for correction and up to the ceiling. Now, if you notice, I'm in a Y position, not here. So we just want to come up to a natural position. 3 rotations. And now we're going to go back into our hand stretch. Lastly, we're going to do our finger touch. This is important. We just want to touch the tips of each finger to the thumb without contorting the hand to do so. So it's just the fingers moving, nothing else, right? That's it. Do those movements every single night before you go to bed. But do your hand on the table movement multiple times throughout the day. That should do it. Once your hand pain dissipates, continue doing the table stretch, specifically if you work on your computer for long periods of time, have arthritis, or you've got carpal tunnel, some kind of disorder in those muscles. I promise you, it will feel much better. All right, until the next issue pops up, I'll see you then.